Hi, my name is Dr. Ian Shuman. I have a general reconstructive and aesthetic dental practice full-time here in Pasadena, Maryland. I'm a master of the Academy of General Dentistry, a fellow of the Pierre Fichard Academy, and past editorial director of continuing education for dental economics. I'm also a Tokuyama customer and a frequent user of the SOFRELINE denture materials. Dentures require relining because very often the patient may have a resorbed ridge and require relining to make up for the loss of the resorbed ridge. They may require it for implant overdentures as a soft liner, as well as other techniques and procedures such as post-extraction or immediate post-extraction where the soft liner comes in very handy. I've been using SOFRELINER for 20 years. We grow our practice by offering our patients same-day relining without having to send the denture out to the laboratory. So one of the products that I use to do chairside relining is SOFRELINER TOUGH. It comes in two viscosities, medium and soft body. In the case of medium, you would use that for complete upper dentures, removable partial dentures, and anywhere where the tissue is a little bit tougher. The SOFRELINER TOUGH soft body material is ideally used in cases where we've done a recent extraction or recently placed an implant. It's fantastic for full lower denture relining and any other case where you require a soft liner. The consistency of these materials is excellent, with the medium body lasting up to 2 years and the soft up to 1.5 years. A properly relined denture will give bacteria and odor resistance. Because of its smooth surface, it has the ability to get rid of or avoid the contamination with microorganisms, as well as create a long-lasting surface that will help the patient with their denture. In this segment, we're going to show a soft reline of the complete upper denture using SOFRELINER TOUGH medium body. Here's a case of silicone remover and removing the actual SOFRELINE base material. One of the things we want to do is create a small gap between the SOFRELINE and the denture base. That way we can drip some of the silicone remover between the SOFRELINE and the denture base, allowing it to permeate underneath that reline and allowing it to be removed in its entirety. Here we're preparing the upper denture for SOFRELINER TOUGH. One of the most common places to have reline peeling away from the denture base is at the vestibule or the flanges. So in order to prevent the material from peeling from the flanges, we're going to create a preparation in the flange itself of approximately 1 millimeter. And that would be a step preparation, as you can see that we've done in this denture. In order to improve strength and prevent peeling of the reline from the denture base, it's important to create enough material, and in order to do that, we need to remove anywhere between 1 to 2 millimeters of denture base material. Doing it in this fashion is actually one of the best ways to create a long-lasting denture reline for an upper denture. The SOFRELINER kit comes with a brush for application of the primer to the denture base. It's important to apply 1 or 2 coats of primer only, as applying more of this material can actually decrease the bond strengths. It's also very important to place the primer over the borders in order to get good adhesion in those border or flange areas. See, there's a notch here and there's a notch here. We want to put that into the notch, close that, lock that down, and then we'll put this on. Here we're applying the SOFRELINER TOUGH medium body to the upper denture. First we apply it to the borders, and then we add enough material to cover the entire palate. Make sure to cover the entire denture surface where you applied the primer with the silicone paste to avoid saliva contamination of the primer. The contamination can result in poor adhesion of SOFRELINER to the denture. Also, over-application of the material can result in the patient choking or gagging on the material as it drips backward into the throat. And under-application is a huge problem because you can't add this material to itself, so you'd have to do it over again. So make sure you use an adequate amount of material to cover the entire denture base, but not too much that it interferes with the patient's breathing or causes them to choke. One of the tips and tricks I like to use to avoid air bubbles in the soft reline process is to make sure that that tip of the applicator stays buried within the material itself. As you can see here, we keep the tip buried in the material, and that avoids the introduction of air to or under the soft reliner tough. Here we're placing the complete upper denture reline in the patient's mouth. It's important to seat it from the soft palate up toward the anterior. That way, the material isn't expressed outward through the back of the denture, but rather through the front, avoiding the patient having unnecessary material going down their throat or causing them to choke. In addition, we want to border mold the denture in order to capture the proper anatomy that will allow the patient to function well. Another important thing to remember is that the material requires a 5-minute setting time intraorally. After an intraoral setting time of 5 minutes, we want to remove the denture from the mouth and carefully trim the excess material with a sharp scalpel. Following this, we use 2 burrs that are included in the Soft Reliner Tough Medium kit. The white burr is called the shape adjustment point, and it's used to smooth the surface and adjust the shape. One of the tips and tricks I like to use with the white shape adjustment point is to apply gentle pressure and just allow the material to flake off under the rotating burr. A little excess here we'll get rid of. There we go. The finishing point in brown is fantastic for polishing the case and giving you a nice smooth luster. Here we're going to reline the lower denture with Soft Reliner Tough soft body material. The technique I like to use for preparing the lower denture is just creating that internal removal of the denture-based material and not extending it over the flanges. Following removal of the acrylic just internally, we're going to create a small bed that goes in the horseshoe shape of the lower arch and allow the Soft Reliner Tough to completely fill in all those areas in order to create a nice cushion for the patient. Soft Reliner Tough comes with mixing tips that reduce waste by 40%. I prefer the soft material because it allows more of a cushion and bounce against the lower arch, which typically is the one that often has most of the sore spots. One of the tips and tricks that I mentioned before, and I'll mention it again, is to keep the mixing tip buried in the material as you're expressing it out. This avoids bubbles, air pockets, and any voids or blebs you may otherwise get. Here we're delivering the lower denture intraorally by placing it against the ridge and applying some pressure, but most of the pressure that's going to be applied is from the patient's occlusion itself. The lower denture will be allowed to set intraorally for the recommended 5-minute setting time. After an intraoral setting time of 5 minutes, we remove the denture from the mouth. We'll use the coarse point, that's the black burr, to smooth the surface and adjust the shape. It's important to make sure you use the correct finishing tools because the Soft Reliner Tough Medium has different burrs than the Soft Reliner Tough Soft kit. Once again, one of the tips and tricks I like to use for removing the excess in the lower denture is by taking the black burr, the coarse point burr, and gently running it against the hard denture base where the soft reline is not placed. Finally, we'll use the finishing wheel that's in brown to complete and finish the denture. By following the protocols recommended by Tokuyama Dental, you will wind up with a smooth, clean, highly polished, and well-finished denture surface. Following completion of relining both the upper and lower dentures, it's important to check the occlusion. And that's exactly what we do here using a horseshoe articulating paper. And we evaluate the patient's occlusion, checking for complete contact, both buccal and lingual, and assuring that the patient has even, stable dentures. During the process and following finishing of the soft relining intraorally, it's important to make sure that the patient's vertical dimension is maintained and not lost or increased. So we do that by using the smart craniometer, which has an offset of 3 millimeters to account for the discrepancy in open versus closed vertical dimension of occlusion. Here you can see we've taken the actual first measurement, which is actual vertical occlusion minus 3 millimeters, and we use the 3 millimeter step in order to verify that by placing it under the patient's nose and chin. Here we see we haven't lost any vertical dimension whatsoever, and that will allow her to function in a healthy and proper way. Using SOFRELINER TOUGH will benefit your practice by avoiding having to send the case out to the laboratory. It saves us on laboratory costs and allows the patient to come in for same-day denture relines. Thank you so much for watching, and hopefully in the future, you'll be a Tokuyama SOFRELINER user as well.